Hello, everybody, and welcome to yet another episode of Health Discourse with Sakshi and Sushant. Hi, Sushant. Good morning.
Hi, Sakshi. Very good morning.
So, folks, welcome back. And it has been a long time since we had another episode. And today's episode is quite special since we are going to cover things about variables. As we can see that these days there are so many smart rings coming up, then there are smart watches, and then there is a CGM which is already there to track your blood sugar levels. So, Sushant, let's begin the discussion. My first question to you is that are these variables actually effective in evaluating the biological processes? Because they claim that they provide accuracy, but how effective it is for the patients when they're using it?
Okay, so before that, let us briefly uh, discuss basics about why do we use or what is the basic output for these devices, right? And then we can get on whether it is helpful or not. So, over last 50 years, I'll say, we have been, or not 50, maybe 30 years, right, we have been uh, focused on a specific healthcare data sets, which is the healthcare delivery. So it means that it is a post-mortem or a summary of what has happened in your body in the last 2, 3, 6 months, right? And it just tell you uh, 10, 15, 50, 100 biomarkers, right? It tells you, okay, you have a high HbA1c level, you have a high blood sugar level, you have an your kidney function is abnormal, your cholesterol is high, right? You have a high triglyceride level, number of these things, right? But we do not have any sort of precise actionables to actually address them, and most of them are driven by guesswork and anecdotal evidences, right? So most of the interventions restricted to either, you know, generic nutrition, have more protein, less carb, less sugar. That everyone know we don't have to consume too much of sugar, right? Or a pharmaceutical approach, which has been a practice. And again, pharmaceutical approach, we know that it is meant to suppress a particular biochemical function, but it triggers a lot of other inflammatory reactions at the body, which have so one symptom converts to three more, and three more converts to nine more, and just go on. So the idea is these. I'm just telling you because this should be very clear in the mind. Right? So the idea is this healthcare delivery data or the plasma level routine diagnostic test or blood works, whatever jargon we want to call it, right? Uh, these tests, are a culmination of millions of biochemical transactions happening inside the body, right? So, so we have 25,000 genes. Our microbiome has around uh, more than 99% of genes are expressed in our body are microbial, right? So 99% of genes are microbial, right? We have 2 to 20 million microbial genes and 25,000 human genes, and mitochondria has its own DNA, right? So again, these are just numbers, and again, based on our interaction with the external environment, whether it is food, nutrition, air pollution, the people we hang out with, the place we live, pets, our sleeping patterns, our stress levels, number of things, these all uh, activate certain genes and lead to production of certain proteins. That proteins trigger biochemical functions. These biochemical functions can be good and bad. And again, if it's bad, it elevates certain biomarkers which we measure, right? And so we are measuring them, and then we do not know what to do about it, right? Because these are summary, right? These are so in essentially these are reactive in nature, right? So you are trying to suppress something which has already happened, right? And same is the situation with the your variables. So only thing is the frequency has changed. So probably you can track on a daily basis, right? For instance, you're tracking your HbA1c level, your sorry blood sugar levels blood sugar spikes on a daily basis. You are measuring now based on the smart rings. Earlier, we used to measure our steps, right? Or heart rate, right? Um, Now we have certain sensors which can measure your heart rate variability, what we call as HRV, can measure your VO2 max, which is again uh, a measure of your exercise performance and number of other things, right? How well your body is utilizing oxygen, then SpO2, and then skin temperature, or all these, or even sleep, right? REM sleep, deep sleep. So again, these are sensors put on these wearables. Again, they're collecting again this healthcare delivery data. So if you have uh, fluctuating HRV, right, or if you have low VO2 max, or if you have deficient REM sleep or deep sleep, so it tells you, you have these things are not going on well on a daily basis. You can track it. Right? But my question is again, this is supplementing the existing routine diagnostic tests. So ideally, you are saying that I'm going to give you another tool at your disposal, which is going to again tell you your sleep is not right, your HRV is not right, your VO2 max is low, right? But it doesn't tell you why it is low, what specific biochemical function. Because again, if you have a low VO2 max level, it is because of 10,000 biochemical reactions happening inside the body, right? So until unless you know which one has caused it, or which combination of which biochemical reaction has caused it, how will you address it, right? And there's no actionables, right? So most of them would be restricted to again generic diet, generic recommendation, sleep well, do exercise, right? Especially VO. So let us start with VO2 max, right? I'm going to take three major aspects of VO2 max, HRV, and sleep, right? And I'm going to mention specific uh, uh, aspects of it which actually is makes them waste of entire time and money, right? And again, so VO2 max is again your ability to use oxygen, right? So again, so we generally measure our VO2 max, and we say if it's low, so you are told to do a lot of exercise. Exercise in stimulates your V2 max. That is one of the factor, right? Uh, the other factor, which is the most important one, and people who come from dentistry, or who understand the microbiome, is the production of nitric oxide, which is again uh, majorly we are more concerned with the oral microbiome, because oral microbiome actually converts, synthesizes nitrate in green vegetables like peas, like spinach, into nitrite. This nitrite mixes with stomach acid to produce nitric oxide. Now, nitric oxide actually improves your VO2 max because it delivers it regulates your blood flow. It delivers oxygen, nutrients to the working muscles when you are exercising, right? So it has a very major role to play in stimulating your VO2 max level, improving VO2 max level, right? So that is the role of oral microbiome, right? And if your nitric oxide is low, probably you have risk of type 2 diabetes, cardiovascular disease, erectile dysfunction, number of other aspects, right? But we are not going to discuss that right now today. But the only thing is, if you have to stimulate VO2 max, exercise is not the only thing which stimulates VO2 max, right? Nitric oxide dilates your blood vessels. It controls your oxygen delivery. It delivers oxygen nutrient to your working muscle tissue. It actually regulates your blood flow, right? So ideally, it stimulates your VO2 max production. The other factor is that there's a gut microbiome delivered postbiotic called urolithin A now, which again a is a byproduct of your microbes metabolizing ellagic acid, which is again could be found in foods such as pomegranate, a lot of berries, right? So a lot of these fruits, what you consume, if your gut microbiome is balanced, probably it could convert these things into urolithin A, and now urolithin A actually improve your muscle strength, and stimulates your mitochondrial efficiency, mitochondrial biogenesis, and so it actually leads to mitophagy, so it gets rid of your dysfunctional mitochondria, and therefore it also improves your VO2 max levels, right? So ideally, you know, if you're thinking, if people are thinking that I'm going to track my VO2 max level, it is low, so I'm going to exercise more, probably that would not be the best way to do it, right? So I'm not saying do not do exercise. Exercise is essential. It actually is very essential part of your lifestyle, but excess exercise could lead to oxidative stress, which again could directly impact your nitric oxide production as well, right? Ideally, you need to understand that apart from exercise, there are other ways you could improve your VO2 max. And if your oral health is compromised, probably you would have a low VO2 max. So people who have done root canals or who have suffering from gum disease or otherwise have cavities, right? All these disrupt your nitric oxide production, and probably you would not have that great VO2 max, right? So to sum it up, VO2 max, measuring VO2 max using your smart rings does not translate first thing into the underlying cause of low VO2 max, and does not give you a concrete actionable that can improve VO2 max, such actionable which are married with your biology, right?
So I think that makes a lot of sense here because apart from the usage and functionality and the effectiveness of these devices, what I am also concerned about is that it keeps you so much heightened. It keeps you all, so much worried about these stats all the time because, sometimes could it actually report and then that comes to the next question. Could it also report a false positive or a false negative? Because that is what we should be concerned about. Let's say if you're doing some activity, let's say you are running and it's showing you your VO2 max is high or something abnormal is happening inside the body. Because if you're going for an extreme sport like swimming, maybe, running or all these things, is it likely to show you some false positives or false negatives?
There are possibility, but the point is, even if they are not,
Hmm.
right? What is the outcome of it? There's
Yeah,
no outcome, right? So what
that's
you do,
correct.
my that's what I'm telling. So if you have a low VO2 max, right? How do you improve it,
Hmm.
right? See, we all know that our biology is as unique as our fingerprint, right? So ideally, same thing cannot work for everyone, right? So someone maybe, maybe exercise may stimulate VO2 max. If that particular, so if someone wants to use exercise to stimulate VO2 max again, uh, exercise could lead to oxidative stress. So probably you have to have a lot of antioxidants in your diet. And again, for antioxidants to deliver that benefit, you need to fix your gut microbiome as well. So even if you're doing exercise, right, to drive the elevated VO2 max levels, still you need to have your balanced gut microbiome. Even glutathione synthesis is actually driven by your gut microbiome. So that is a problem with these devices. Uh, you do not know the underlying cause of a particular biomarker going out of range, right? And then you do not know what you need to do, what actionable you should have. That is a problem. Yeah, false positive would be there, obviously. And so what is the regulatory aspect of it? Has there been any clinical studies on its so idea is, have you checked the impact of these biomarkers on a patient's self-reported symptoms, whether it has improved or not, whether you have actually checked it or not, right? Point is whether you have a clinical validation study. Let's forget about the external study involving clinical trials and all those things. But have you done an internal validation study on the impact of these biomarkers on various symptomatic conditions, right? Which is not there. Yeah.
Yeah, that's correct. And being a person from the technology background, I'm also concerned that where is the data going? Are there data centers based in India? And because, some of them might have a manufacturing contract with companies from outside India. So are they actually able to utilize that data and benefit some give benefits to the patient out of that? First, that is a question that I have. And secondly, if that data, as you are saying, that is it of any use when if we use it in terms of a machine learning or AI, if we apply all these tools, is it going to give us a good amount of efficacy or a good p-value that these stats are actually working in favor of human health?
See, see, these statistical measures are a way of testing the significance of your clinical study or internal validation study, right?
Absolutely. Yeah.
Applying ML and AI. Again, ML and AI are systems, right?
Mhm.
This data is a fuel for these systems,
Yes,
right?
yes.
So ultimately, if you have the right data sets, for
Mm,
instance, if I have the right data sets to know, okay, which specific metabolic or a biochemical reaction is
mm,
causing, let's go to HRV, is causing fluctuating HRV, right? Then only I can address it. You
mm,
are saying I've seen ads by a lot of these companies, and I don't want to name anyone, right? Everyone
mm.
is doing their own job. They are
Yeah.
they are doing their part, right? The point is, you are saying that track your heart health with HRV, track your stress level with HRV, right? But what after that or what before that? So you're again tracking the what has happened, right? What is happening, right?
Mm,
If I know that my HRV is fluctuating because of ABC reasons, I can address them, right? And then that is the right data sets. Okay, so for instance, let us talk about HRV. So if you track a fluctuating HRV, right? Is it because of histamine overproduction, which actually, it stimulates your immune reaction? It is because of low bitrate, which again is strengthens your gut lining and modulates your immune functions. Uh, is it low nitric oxide production, right? Is it certain protein fermentation metabolites such as precresol, right?
or
Is
maybe
it,
indoxyl sulfate for that matter.
yeah, or is it low GABA production,
Mm,
right? Again, because we know GABA modulates our stress level, right?
mm, mm.
So number of these factors would lead to impact. I'm just giving few names, even LPS, lipopolysaccharides, which is again both most harmful endotoxin, which causes diabetes and cardiovascular disease as well, right?
Yes.
And it also impacts sleep. So I'm going to come on the sleep also, right? The
Mm,
sleep aspect of it, right? So even if you track it, if you don't know specific, you do not know the specific pathway
mm,
or specific biochemical function or a combination of different functions which is causing that, right?
mm,
Uh,
mm,
how would you address it? Or what kind of interventions you'll adopt until you don't know the root cause, right? And again, it needs a completely different data sets than what they are currently collecting. So you're
mm,
currently collecting healthcare delivery data set. Well, so you are just supplementing your blood works. You're collecting healthcare delivery, what has happened. So healthcare
mm,
delivery means based on certain biochemical functions, what has happened, I'm tracking what has happened, right? So we know that we at GeneFit have been tracking on every single data points which tells what biochemical functions are happening right now and how combination of different biochemical functions we are using machine learning models are our own proprietary. So it's not chat GPT or any sort of generative AI or all those things we have built in-house, right? So these models based on the data we have collected, the molecular data we have collected. So we could measure them and tell these specific combination of these specific pathways is causing these issues, right? For instance, you remember we developed this triglyceride profile, so we could tell at cell level what is your triglyceride levels, which may not your blood work may not show triglyceride to be abnormal, but we can tell whether it is abnormal or not. So that is one aspect of your answering one aspect of your question. Other is coming on to the data. So I don't know about a lot of these variables, but some of them what I have read is and what I believe may be true is that These are mostly licensed models. So as you rightly said, these are they deploy contract manufacturing companies, and that have been a typical practice. So I'll tell you how this is coming. This is coming from these. If you remember, 10 years back, there was something called uh, set-top boxes for cable network, right? And most of the set-top boxes were and all these devices, right? Portable devices for set-top boxes and the internet devices and all those things were uh, you know were deployed, made by contract manufacturing companies, right? So either they used to outrightly purchase it, right, or adopt a licensing model. Either of the ways, they never owned the IP, right? Okay. So when they don't own the IP, because they are paying a particular fees for manufacturing their product, right? And then probably if they're even using their IP, you're paying licensing fees again. Even if you have that data at your disposal, which I have a doubt they have, right? If they're not owning the IP, if they're just outright purchasing it, so probably you don't have the data, right? Or even if you have, this data is being shared because that IP belongs to someone else, right? The data is shared with your contract manufacturing company, which could be either in India, right? So as far as I remember, 10 years back when I was also working in this media and entertainment space where we were working on building, these wireless set-top boxes and OTT platforms using set-top boxes. I had worked in that space earlier. So, so at that time there were certain contract manufacturing companies in Chennai, right? And now they may be in China as well. I don't know. Right? But most of these I know have been made in China. So even your Apple phones are made in China. But now it has been started made in India. But that's not a point of discussion, right? But the point is, yeah, to answer your question, yeah, there are doubts on whether the data is being actually stored in India, is actually being used to derive insights or not, right? Or it is actually shared with other manufacturing companies, contract manufacturing companies. So that is again an question which there has to be a regulatory aspect.
Yes, I think wellness sector, if you ask me, there has been a lot of abuse of all the solutions and services one by one. When even recently that somebody proposed, somebody from the ICMR, I don't remember the name, but they proposed that whatever supplements, if they claim to be get helping a person getting rid of some condition, health condition, it has to come under CIDISCO, the nutraceuticals part, right? Similarly, I think if we are measuring something which is an important health parameter, that should also fall under some kind of a regulatory, and specifically the medical devices part, I feel that, because it's not only about data going outside the country, it's a matter of privacy as well. I mean, obviously data privacy is something which is very important here.
See, when you're talking of these, everyone is going to do, I'm HIPAA compliant, I'm this compliant, that compliant. People claim that. No.
Yes.
These are the issues which has to be addressed at a regulatory level. But
Yes.
these are the, I'll say structural issues, right? The functional issues itself is a question mark because, you know, these biomarkers does not deliver disease modifiable interventions,
Mm.
right? That is a problem. And what I see is what is going to happen. What I see these folks, I don't know why India lacks innovation in healthcare. Is this they just want to have an quick fix for everything, So the point is that you have these, and then you will, based on these biomarkers, you are still going to sell supplements, right?
Mm.
And most of these supplements are synthetic compounds. They are meant to inhibit or stimulate certain biochemical reactions, but
Mm.
until unless you do not know, measure which one is going haywire, how will you address it? And these are again over the counter. So so CIDISCO approval, I don't think so. It should come, but the problem is these are categorized as nutraceuticals, and again, nutraceuticals until unless they're not making any health claims, right? They would be sold
They
as
will fall
supplement.
under drugs if they are making any health claims.
Yeah.
For that matter, I think in a matter of some years, obesity will also become, getting rid of obesity will also become a health claim because it's a very serious issue that a lot of people are addressing through supplements. But anyways, I think let's just go back to uh, what is the benefit for a patient, okay? Because what we are here to discuss is for for the sake of the patients or for the end users who are using these devices. It definitely gives them something to track, okay, which is fine. But I feel if something, a sort of device which is put on my wrist or or my fingers, and it is giving me a constant update, okay, this is happening, that is happening, I will be too much engrossed in that stuff rather than focusing on improving on improvisation, because my mind will be actually focused on, okay, something bad is happening, and I'll be worried all the time. It will lead to some anxiety issues as well. Of course, in some people I've seen that, one or two friends I've seen that they actually had gotten rid of their Apple Watch or another smart ring, and they claim that it was giving them anxiety. Every time it is the device is beeping, every time it is giving you some insights, right? So, what should be the ideal approach for people? Let's say there are so many problems, okay, diabetes, chronic kidney disease, cardiovascular disease, they all stem from the oral microbiome, as we have previously discussed, right? So what should be the ideal approach for the end users?
So
I mean,
first of all, Sakshi,
yeah.
these see for me it is these are just another tool, another toy, right?
Mm.
These until unless these devices can tell with precision that this specific pathway or function is causing elevated blood pressure, HRV fluctuation, low VO2 max, or even for sleep that matter, So if you're tracking REM sleep, right? If you have deficient sleep or low quality sleep, what interventions do you have?
Okay.
So thing is, people will say, stop using mobile at night. Okay, with that we all know
And then supplements, they give you
what
magnesium
is new.
supplements.
So yeah.
So
So the point is, sleep again. You have to understand that there's a biochemical interaction happening. So your gut-brain axis talk to each other. So if your gut is producing harmful metabolites that can cross the blood-brain barrier, go to brain and stimulate HPA axis, this triggers cortisol. Cortisol is stress, increases your stress level, it disrupts your sleep, right? So, or you are consuming fluoride rich toothpaste, which enters your pineal gland and which disrupts your melatonin production, which could disrupt your sleep. So I'm just giving you a few examples. So until unless you track them, how would you, until unless you know which specific things are pathways are causing it, how will you improve it? So the
mm,
biggest flaw in these models is, okay, I have this data, what to do? Same thing is there. You track your HbA1c level, you track your blood sugar levels, you track your blood pressure. How many people has reverse diabetes? None. How many people have improved their heart health? None. How many people have improved their chronic kidney disease? None. Right? They've been rather increase in the number of people developing these diseases, which is, so they are already developing it, right? And again, the thing is, it's only showing up now after 15 years of manifestation of disease.
it is not shown up before, and it never shows up before in a pre-stage or even at an early stage.
Yeah,
So
yeah. So
yeah, that's
again,
the
I don't
problem.
want to talk about our product and right now because that will get into too much science. Right? But yeah, we
Mm,
are detecting disease at a very early stage, at least 10 years before you actually show up in your symptoms. Right.
mm,
So the point is that in my opinion, honest opinion, if you are a youngster and you want to track it or you are living it and you want to show off, I have this ring, that ring, fine, do it. No problem. You track your HRV levels, fine, do it. You track your VO2 max, do it. But you are not going to drive any meaningful interventions out of it. Right? That is a bigger problem. And also, as you rightly said, the issue is you are giving your personal data, where it is
yeah.
getting stored, right? What is the first thing is where it's getting stored, where with whom it is getting shared. Second thing is what is the proof of this data being the tracking mechanism being authentic or being accurate, at least 80% of the accuracy. Where have been a clinical studies, internal clinical studies, you are selling 200 rings, you have 200 customers, track their data,
No, there's some of the brands they claim they've sold over 1 million rings globally, and
let's
I think
let's
that
say 1 million, let's say 1 million.
and million is a very good data set for you to train your model and for you to publish something around
No,
as an internal study. So
Sakshi, the problem is what you will train. So you have what you will get. You will get this particular age group, this particular male or female, this particular city. These are the biomarkers. This, right?
they can do a
Ha,
population study at least.
ha, yeah, but
Yeah,
have they tried to do a mapping of these biomarkers with various symptomatic conditions? So I know how much symptoms we track. We see when we are seeing the impact of our molecular insights and interventions based on symptomatic conditions. We are looking at more than 1,000 symptoms for every
yeah, that's
patient
correct.
every 3 months,
Yes.
right? So for every patient, we are doing 4,000 of symptomatic conditions in a year. How many of them have used the impact on the self-reported symptoms?
Mm.
See, you have to see that impact. At least bring that impact. I know you are not doing molecular data. You're not looking at cellular level. You're not looking at mitochondria. You're not
But
looking at
even though
microbiome.
through blood works you can see that
No,
what is the impact.
blood works efficiency is a question mark. So blood work is because you go to two different labs, you have two different results, right? As I
Yeah,
mentioned,
but
because it is no, and again, blood works is based on it is comparing your result with the other unhealthy people,
unhealthy population.
right? For instance, I read somewhere there's some company being funded which is actually tracking your hormones,
Right,
right? So if you have a thyroid issue, let's assume you check your TSS, T3, T4 levels, right?
right.
And if it's abnormal, then probably doctor may give you some medication or some
Mhm.
hormonal thing, right? But if it's not, doctor will say normal. But again, it is not normal because you have cellular inflammation. Cells are not expressing thyroid receptors, hormone receptors on its cell membrane, and hormones cannot communicate with cells to alter your metabolic activity, to alter your genes expression, to
Mm.
stimulate mitochondrial function, number of these things, right?
Yeah.
Right? For instance, estrogen directly impacts your mitochondria. So
Mm.
females in a particular month at different times they would have high energy, different times they have low energy,
That is
right?
there. That is a part of the feminine
Because
cycle.
it's because of the cellular inflammation,
Mm.
right? If your cells are inflamed, they do not express dock receptors because on these receptors these hormones can dock and communicate,
Mm.
right?
Mm.
So the thing is, I'm just giving you an example. All these tests are just whitewash. It has no benefit. And it's clearly visible that we don't have any solution for thyroid. We don't have any solution for endometriosis. We don't have any solution for PCOS. We don't have any solution for obesity, right?
Mm.
And leave people who are saying eat protein, eat less calories. All this are bullshit crap. So this is a waste of time and money.
Okay, so Sushant, I think we've come to the conclusion of the discussion. Any last words would you like to add here?
So first thing is it's for both for consumers and for companies who are selling these things, right? For consumers, probably this is not going to work. These are fine to track, but if you are thinking of using it to reverse a health condition, I'm sorry, it is not going to do. It is not going to help, right? And I'm telling you because we study cellular biology, so we know in and out of. We study microbiology, we study cellular biology of every individual for so many patients who sign up with us. So we know in and out of it, right? So these are just a way of tracking mechanism, good for youngsters, right? So if you want to track your VO2 max, HRV, sleep level, do it, but it is not going to, if you're thinking of, oh, my sleep is bad, how do I improve it? You're not going to get any insights, right? Frankly, no human can tell you what you should do because every single biomarker is a culmination of thousands of biochemical transactions. So no individual, no doctor can even tell you, right? And for the companies who are selling this, right, please bring some innovation. Do not contract manufacture it. Spend money, build your own data servers, right, and also try to map it with the symptomatic conditions. Do clinical internal validation studies on this, right? Probably do not publish if you don't want to, but at least who asked and whoever asked about this, you should have data to justify your claims, right? So because right now it's most of them I have seen have are been outsourcing the manufacturing or have been using a licensing. This have you, I don't know whether someone is doing a patenting. Probably I would like to learn more about it, but I've not seen anyone having a patent on this. Or maybe very few people may have a patented sort of smart ring or in India, I'm talking not about outside India. I'm talking about India. So I've not seen anyone having a patented technology or patented smart ring or watch, right? I never use them. I still use Apple Watch to track my steps. That's it. Apart from that, I don't do it. Yeah.
Thank you, Sushant. That was a very wonderful discussion, interesting discussion, and obviously, let's hope it helps people out there, and they would want to spend their money wisely, right? Because we've seen that
Yes,
uh,
see, you are spending
devices,
30,000 rupees on these devices.
yeah, yeah. So that's the part of
And
the
and again
disposable income,
another point, because I've worked in finance for 25 years, so I'm giving
right?
you any suggestion for the companies here. So if you really want to sell and make business, give the device for free, start charging subscription on this. That is how you make money. You want a
Yeah, that
recurring, you want a
it
recurring
used to.
subscription, or you just want an outright sale. Right?
Yeah, that makes more sense for the businesses
Yeah.
in this space. So thank you, Sushant.
Thank
Thank you
you.
once again. And folks, we'll be back with another episode. Thank you for listening to us.